Hello, welcome to St. Alphonsus Heart Failure Education. My name is Tirza Rome, the Heart Failure Nurse Coordinator for St. Alphonsus, and I will be leading this education session. Our goal for this education time is to discuss what heart failure is, what to expect with heart failure, and what you can do to live healthier with heart failure. For this education, we will be using the American Heart Association's book, Healthier Living with Heart Failure, Managing Symptoms and Reducing Risk as our resource guide. Before we talk about heart failure, it is important to understand how the normal heart functions. The heart is a muscle that's sole purpose is to pump blood to the entire body. The heart's pumping action moves used blood that returns to the heart through the veins, through the right atrium, and into the right ventricle. The right ventricle then pumps the blood back out of the heart into the lungs to be replenished with oxygen. The heart's pumping action then moves oxygen-rich blood from the lungs to the left atrium, then on to the left ventricle, which pumps it to the rest of the body. The left ventricle supplies most of the heart's pumping power, so it is larger than the other chambers and essential for normal function. So now, with that in mind, what is heart failure? Heart failure is a chronic, lifelong condition in which the muscle in the heart wall slowly weakens and enlarges, preventing the heart from pumping enough blood to the body. As a result, your body isn't getting enough oxygen-rich blood needed to function properly. There are two main types of heart failure, left-sided and right-sided heart failure. Left-sided heart failure is when the left side of the heart is working harder to pump the same amount of blood than it's used to. There are two types of left-sided heart failure. First, there is heart failure with reduced ejection fraction, also called systolic failure, which is when the left ventricle loses its ability to contract normally due to the muscle becoming thin and weak. The heart can't pump with enough force to push enough blood into circulation. Second, heart failure with preserved ejection fraction, also called diastolic failure, is when the left ventricle loses its ability to relax normally due to the heart becoming thick and stiff, causing the heart to not properly fill with blood during the resting period between each beat. Right-sided heart failure usually occurs as a result of left-sided failure. When the left ventricle fails, increased fluid pressure is, in effect, transferred back through the lungs, ultimately damaging the heart's right side. When the right side loses pumping power, blood backs up in the body's veins. This usually causes swelling or congestion in the ankles, legs, or abdomen. Congestive heart failure is when your body becomes congested with fluid as a result of your left-sided or right-sided heart failure. This can require seeking timely medical attention. There are a few tests that can be used to diagnose or determine severity of heart failure. There is the echocardiogram, which is an ultrasound of the heart, a cardiac MRI, a stress test, which is an exercise test for the heart, electrocardiogram, or EKG, which looks at the rhythm of the heart, or heart catheterization, which looks for blockages in the arteries of the heart and measures pressure within the heart. There are also several blood tests that can be helpful in the diagnosis and treatment of heart failure. When diagnosed with heart failure, you may hear the term ejection fraction used. This number is obtained by a test called echocardiogram, which is an ultrasound of the heart. The ejection fraction compares the amount of blood in the heart to the amount of blood pumped out. The fraction or percentage helps describe how well the heart is pumping blood to the body. Normal ejection fraction is 50 to 70% of blood pumped out during each contraction. Borderline ejection fraction is 41 to 49% of blood pumped out during each contraction, and reduced ejection fraction is 40% or less of blood pumped out during each contraction. With proper care and treatment, many patients are able to improve their ejection fraction. The most common cause of heart failure is atherosclerotic disease. Atherosclerosis of the body's blood vessels occurs when arteries become narrowed by the buildup of fatty deposits called plaque. Our lifestyles can increase our risk for heart failure, such as smoking, being overweight, lack of physical activity, and alcohol or drug abuse. There are also some medical conditions that can increase our risk. To list a few: coronary artery disease, high blood pressure, type 2 diabetes, past heart attacks, abnormal heart valves, congenital heart defects, and heart muscle disease can increase risk for heart failure. Treatment of heart failure can be dependent on what caused it. The underlying conditions must be treated or corrected. For example, repairing or replacing heart valves, or treating an abnormal heart rhythm, or controlling high blood pressure. The treatment plan is personalized to the individual to address their specific condition. Along with treating the underlying cause, heart failure also requires treatment, which will likely include dietary changes, medications, lifestyle changes, and possible device placement or surgical procedures. The effects of heart failure can be felt throughout the body. Some common symptoms to watch for are swelling to the legs, arms, or abdomen, shortness of breath, and fatigue. It is important to go to the emergency room if you feel lightheaded or as if you might pass out, if you have fluttering or racing of your heart, or you feel sudden chest pain or heaviness. Heart failure symptoms usually develop over time as your heart becomes weaker and less able to pump the blood the body needs. When these symptoms occur, it is called congestive heart failure, due to fluid building up in various parts of the body. As blood flows out of the heart, blood returning to the heart through the veins backs up, causing congestion in the body's tissues. As noted, the swelling is most often seen in the ankles and legs, but it can happen in other parts of the body as well. Sometimes fluid collects in the lungs and interferes with breathing, causing the shortness of breath. Heart failure can also affect the kidneys and their ability to dispose of sodium and water. This retained water also increases swelling in the body's tissues, also known as edema. Keeping those symptoms in mind, I would like you to look at this guide like a stoplight. The green, or top box, is the goal. This is you living your best life at home. You are at your baseline level of shortness of breath, normal activity level, baseline swelling level, and stable weight. The yellow, or middle box, is when you first start noticing those changes in symptoms. You may notice a new cough, or worsened shortness of breath, decreased activity tolerance, or an increase in weight of more than 3 pounds in one day or 5 pounds in a week. This is when we want you calling your doctor, when you first notice the symptoms and not waiting until your symptoms are intolerable, which is the red, or bottom box. This is when you need immediate help and need to go to the emergency room. Our goal is to help you keep living your best life and to help keep you out of the hospital. This takes teamwork in you noticing these changes and then communicating them to your healthcare team so they can make the appropriate recommendations or medication adjustments. Along with recognizing symptom changes, there are also some lifestyle changes that can help you feel better, manage your symptoms, and help control your heart failure. One main dietary change is eating a low-sodium diet. Excess salt causes water buildup in your body. With more fluid in the blood vessels, the heart has to work harder to pump. Over time, this fluid buildup can cause shortness of breath and swelling. The recommended sodium restriction is 1.5 to 2 grams of salt per day. It is important to realize that this is not very much salt. 1 teaspoon of salt is just over 2 grams, for perspective. Some tips on how to reduce sodium at home are: get rid of the salt shaker, use spices for flavoring, and eat fresh vegetables, fruits, and meats instead of canned and processed foods. Most foods that come in a box or a can are high in sodium, so try to avoid them. If you do choose to eat those items, look for the low sodium options. It's important to read the food labels, particularly looking at the sodium quantity along with the serving size. Remember, the recommended restriction is 1.5 to 2 grams of sodium a day, so I would recommend keeping a diary of your sodium intake throughout the day. Just because you stop actively putting salt on food does not automatically mean you are eating a low-sodium diet. There are some foods that you may not expect have sodium in them, so it is important to be aware of these food items. As previously mentioned, food that is in a can or in a box usually is high in sodium, but also foods such as ham, bacon, and sausage are very high in salt content. It is also important to remember that condiments and pre-seasoned mixes are usually high in sodium. When grocery shopping, look for fresh and low sodium options. As you can see, for each food group, you can find healthy low sodium options. For fruit, look for fresh or canned and frozen that are unsweetened or canned in their own juice. Vegetables, fresh or frozen, are the best, or canned if low sodium or no added salt, then rinse to remove excess sodium. For meats, looking for fresh or frozen lean meats without breading or skin are the best. For example, fish, chicken with the skin and fat discarded, or lean cuts of beef with fat trimmed off. For canned meat, look for ones packed in water with no added salt. For other protein sources, using dried beans, low sodium peanut butter, unsalted nuts or seeds, or eggs are all good sources of protein. For dairy, the low-fat milks such as skim or 1% are lowest in sodium, or using a milk substitute such as almond milk is also a good option. Cheese can also have significant sodium, so look for the low-fat, low-sodium labels. For breads and grains, look for whole grain options, brown rice versus white rice, or corn tortillas versus flour. Along with tracking your sodium intake, it is important to limit your fluid intake to no more than 2 liters or 64 ounces per day. This restriction is for all fluid intake, not just water. For example, you will need to consider if you drink coffee, tea, juice, milk, or other beverages. Some food items may also be included in this, like soup or cereal. Also keep in mind that caffeine can increase your heart rate, so if you drink caffeine, you should talk to your provider regarding whether you need to reduce your intake or stop entirely. It is recommended to abstain from any alcohol intake. Alcohol can cause high blood pressure, increased heart rate, heart arrhythmias, weakened heart muscle called cardiomyopathy, and heart failure. The goal of heart failure treatment is to help you live a longer, better quality life. Lifestyle changes, such as sodium and fluid restrictions, may not always be enough to manage your heart failure. Medications are often also required to help lessen fatigue, shortness of breath, and swelling. They also can help improve your energy level so you can be more physically active. Medications can stop or slow progression of heart failure by making the heart stronger. Because of this, it is important to take your medications as prescribed. Some medications can have side effects and can affect your blood pressure. Checking and recording your blood pressure each day at approximately the same time every day can be a useful tool in helping guide your healthcare team in your medication management. Many people with heart failure are prescribed diuretics or water pills to help them get rid of extra water and sodium, which reduces their heart's workload. If you are taking a diuretic, it is important to weigh yourself daily at approximately the same time each day and record those weights. Weight gain of 3 pounds in one day or 5 pounds in 1 week may be a sign of fluid buildup. If you notice this trend in your weights, let your healthcare team know immediately. Your medications may need to be adjusted. If not treated, fluid buildup makes the heart work harder and may cause worsening shortness of breath and edema. Early recognition of these changes may help you avoid hospitalization for worsening heart failure. People with heart failure are often on many medications. It is important you understand the medications you are on, including when, how often, and in what amounts you are meant to take them. Some helpful tips on how to do this are: keep a record of all medications you are taking, prescription and over-the-counter, and take this record with you to all medical appointments. I would also recommend using a weekly pill organizer so that you can be sure you are not missing any doses. With heart failure, you may find that your medications or medication doses will change over time as your medical team works to optimize your personal treatment plan. Heart failure can almost always be managed, but it does take lifestyle changes and certain medications. Certain lifestyle changes can help improve heart failure symptoms, slow progression of the condition, and improve everyday life. These 6 changes will be our focus in this discussion: weight loss or maintenance, quitting smoking, regular physical activity, getting enough rest and sleep, managing stress and anxiety, and dealing with depression. First, weight loss or maintenance. Extra weight makes your heart work harder to pump blood through your body. If you need to lose weight, determine how much weight to lose and how to lose it safely. Second, quitting smoking. If you smoke, quitting can help you manage and improve your symptoms and quality of life. Nicotine from tobacco smoke increases heart rate and blood pressure. During smoking, carbon monoxide also gets in the blood and robs your heart and brain of needed oxygen. Smoking can also decrease tolerance for physical activity and increase tendency for blood to clot, along with decreasing good cholesterol, known as HDL. Talk to your healthcare team regarding getting help with smoking cessation. Third, physical activity. Regular, moderate intensity physical activity can help your heart get stronger. With daily activity, most people with heart failure can experience some of the following benefits. You may feel more energetic, have improved mood, weight loss or maintenance, reduction in stress, feel less tired, and lower blood pressure. Make time every day for moderate intensity aerobic physical activity, such as walking, swimming, or biking. This may seem daunting, but start slowly. Gradually build up to at least 150 minutes per week. You can meet that goal by aiming for 30 minutes 5 times a week, or if you can't manage 30 minutes at a time, try multiple shorter bouts of exercise throughout the day to meet your goal. Fourth, getting enough rest and sleep. It is important to schedule time every day for rest and relaxation. Rest times are essential because they give the heart a chance to pump more easily. Daytime rest can help keep you from overdoing it by easing feelings of tiredness. Try to form a healthy nighttime routine to ensure you are getting good quality and enough sleep. Fifth, managing stress and anxiety. You may have times of feeling anxious or nervous about your diagnosis. Everyone has certain stress triggers or things that cause your heart to pound and make you breathe harder. It's important to work to manage stress and anxiety because they make the heart work harder, which can make your symptoms worse. Try to find healthy outlets to manage your stress and anxiety. And finally, sixth, dealing with depression. It can be normal to feel sad when being diagnosed with a chronic condition. But if these feelings continue for long or interfere with normal activities, you may be depressed. Depression can slow your recovery and increase your risk for future cardiac events. If you've been feeling down or hopeless with little motivation or interest in doing your normal activities, talk to your healthcare team. Don't be afraid to talk about your feelings regarding your condition. To summarize, it is important to take all your medications as prescribed. Talk to your healthcare team about any side effects you may be having so they can make the appropriate adjustments. Also, eat a low-sodium diet of less than 2 grams per day. Meal planning may be the best method to accomplish this. Next, weigh yourself daily and track your weights. If you gain more than 3 pounds in one day or 5 pounds in 1 week, notify your healthcare team. Know symptoms of heart failure and how they affect you. Through this process, maintain close contact with your healthcare team. Managing heart failure is teamwork between yourself and your healthcare team. And finally, stay as active as you're able and spend time with your loved ones. Managing your heart failure symptoms is about returning to function and doing the things that make you satisfied with life. Listed here are some additional resources for you and your family for support. Our goal through this education session is to give you the information and tools required to be able to reclaim your quality of life so that you are thriving and not just surviving while living with heart failure. Thank you for your time during this education session. I hope you have found it informative and beneficial. Take care.